Namaste.
From Dr. Jeevan K. Jose. Ayurveda manages infertility through a holistic approach that includes a balanced, nutritious diet, detoxification, panchakarma, and herbal remedies. Treatment focuses on balancing doshas and addressing underlying conditions while promoting emotional well-being. Regular consultations with an Ayurvedic practitioner help tailor treatments to individual needs, enhancing overall reproductive health. Infertility refers to the inability to conceive after a year of regular, unprotected intercourse. It can affect both men and women and can result from various factors, including hormonal imbalances, structural issues, age, lifestyle choices, and underlying medical conditions. Ayurveda management of female infertility. We are going to start with one of the common cause of female infertility, PCOS, or polycystic ovarian syndrome. Polycystic ovary syndrome is a clinical syndrome characterized by mild obesity, irregular menses or amenorrhea, and signs of androgen excess, example hirsutism, acne, etc. In patients, the ovaries contain multiple cysts. Areas of thickened, darkened skin, acanthosis nigricans, may appear in the axillae, on the nape of the neck, and in skin folds. The cause is high insulin levels due to insulin resistance. Ayurvedic view of PCOS can be correlated to anartavam, alpartavam, vishama artavam, etc. The line of treatment can be planned as per the Vandya Chakitsa, Vishamartava Chakitsa, Avarana Hara Chakitsa, Arajaska Chakitsa, Puspagni Chakitsa, Kashayanarthava Chakitsa, Granthi Artava Chakitsa, and Saintalya Chakitsa. Line of treatment is based on Adipravarti or apravarti, meaning excessive or scanty bleeding, Stola or Krisha, meaning obese or lean. Coming to obese PCOS. First line of treatment is the weight reduction, which can be done with Vyarchanam, Udvarthanam, Thakrapanam, etc. Kashaya, having Kapha Medho Hara action, having action on the disease, can be used. For weight reduction, we can use Varanadi Kashaya, Sapthasaram Kashaya, Kanasatavadi Kashaya, Punarnavadi Kashaya, etc. Tablet Kanjanara Gugulu, Tablet Chandraprabha Vati, Gugulu Panchapala, Chornam, etc. For drinking water, Asana or Venga, Pterocarpus marsupium, Pania can be used. In lean PCOS, a small but significant proportion of patients present with normal or less body mass index, BMI less than or equal to 25 kg per meter square, that makes diagnostic workup and therapeutic approach more difficult. These cases are termed as lean PCOS. While people with lean PCOS can still have the same health complications that come with other types of PCOS, diabetes and insulin resistance tend to be less severe. Ati-pravarti, or excessive bleeding. Menorrhagia is an abnormally heavy and prolonged menstrual period at regular intervals. Signs and symptoms include bleeding substantially heavier than the patient's usual flow, bleeding lasting more than 7 days, flow associated with passage of significant clots, anemia, etc. Complications can be: over time, the blood loss may lead to anemia, shortness of breath, tiredness, weakness, tingling and numbness in fingers and toes, headache. Ayurveda management of ati-pravarti, or excessive bleeding. The Ayurveda correlations are
Pradhara Chikitsa, Adogatha Raktpitha Hara Chikitsa, Sita Virya Dravya Prayoga, Stambhana Chikitsa, Pandu Chikitsa. Coming to the Ayurveda medicines. Common Kashya yogas can be Dusparshakadhi Kashya, Vasaguluchadhi Kashya, Musli Khadiradi Kashya, Lodhradhi Kashya, Thrayantyadi Kashya, Churna Kalpana like, Pusyanuka Churnang, Capsule Menorix, Rindu Menestid, Syrup Menokang, Lahya Kalpana like, Sathavari Lahyam, Amlaki Lahyam, Ghrata Kalpana like, Mahathik Thaka Gritham, Asoka Gritha, Fala Sarfis, Imhk Elva Akm Dhrita, Asava Kalpana like, Lodhraswam, Asho Kyarai Am, Rasa preparations like Pravala Bhasma etc. Vasti can be done with Nyagrodadi Gana Kyare Vasti, 900 milliliterlu. Yoni Piku with
Nalpamaradi Tailam, Tanvantara Tailam, etc.
Coming to the opposite condition, amenorrhea or scanty bleeding, apravarti. Amenorrhea is the absence of a menstrual period in a woman of reproductive age. Amenorrhea is considered as anartavam. Primary amenorrhea may be difficult to treat with only medication. For secondary amenorrhea, prognosis is good in most of the cases. Line of treatment may be understood from Gulma Chikitsa, Udavartha Chikitsa. The treatment should align with Kapha Vata Hara, Ushna, Lakana, Sita Nishanam, Raktavardhanam. Coming to the Chikitsa or Ayurveda management of apravarti or scanty menstruation. Kasaya Kalpana commonly used are Kanasathavadi Kashayam, Sapthasaram Kashayam, Gandharvya Hastadi Kashayam, Kulathadi Kashayam, Thila Kashayam, Chorna Kalpana like Hingavachadi Chorna, Krishna Jiraka Chorna, Kalyanika Kesharam. Vati or Galika Kalpana can be Rajapravarthini Vati. Laya Kalpana can be Pulim Kuzambu etc. can be used. Sodanam, if periods gap is more than 2 months and obese person. Sneha Panam, dose is fixed based on Agni Balam of the patient. Sneha Pana can be done with Dunvantram Tailam. Sukamara Gritam, along with Pipalyadi Tailam. Thila Tila or Sarshapa Tila etc. Vyarkanam may be done with Kalyanika Gulam, Sukumara Arandam Tailam, etc. Investhi. Anavasana Vasti can be done with Pipalayad, High Tailam, etc. Niruha Vasti. Lakana Vasti, Danyamla Sarshapa Kalka, Pipalyadi Tila. Yapana Vasti. Uthara Vasti, Lekahana to Brimhana. In PCOS, reduced thickening of endometrium can be common. Here Kapha Kesaya and Vatavardi in Vadasthana takes place. Madura Rasam and Brahmana Uzadam helps when given after appropriate sodanam. For Vyarkanam Trevert Layam, Kalyanika Gulam etc. can be used. Kashaya Kalpana like Sukamara Kashaya, Drakshadi Kashaya etc. In Vasti, Yapana Vasti is effective. Anavasana Vasti with Sukamara Gritha, Phalasarphus etc. Pratimarsa Najam with Dunvantharam Tailam, Shirabala Tailam etc. Laya Kalpana like Kushamanda Rasayanam, Shathavari Layam. Internal administration of Tila Kalpana like Shira Bala 7 of Arthi Tailam, Sahacharati Vasti Pakam etc. Gritha Kalpana like Sukumara Gritham, Dadamadi Gritham Kalyanika Gritham also can be utilized internally. Arishta Kalpana like Kumariyasavam, Asokarishtam Draksharishtam etc. Shira Kashayam with Sathavari is also found to be effective. In PCOS, with an ovulatory menstrual cycle. Kapha Vata Haram, Ushnam, Annulomanam type of drug selected. The treatment should be Gulma Nisanam. Katu Rasam, Lakanam, Sophignum, Artava Pravartanam type of drugs are selected. Vyarchanam with Sukamara Aranda Tailam, Kalyanika Gula etc. can be done. Kashaya Kalpana Loika Sapthasaram Kashaya Kulathadi Kashaya, Kana Sathawadi Kashaya, Maha Rasnadi Kashaya, Tiala Kashaya etc. Vati Kalpana like Rajapravarthini Vati, Chandraprabha Vati etc.
Arishta or Asva Kalpana like Abhyarishtam, Kumarisavav, Lohasavav, Jekhrishta etc. Rasa Aushda like Loha Bhasma can also be utilized.
Dysmenorrhea is the medical term for menstrual cramps associated with lower abdominal pain, which can be sharp or aching in nature or back pain. Common symptoms include aching pain in the abdomen, feeling of pressure in the abdomen, pain in the hips, lower back, and inner thighs. When cramps are severe, symptoms may include stomach upset, sometimes with vomiting, loose stools, etc. Ayurveda approach is based on Vata Kapha Hara Chikitsa Gulma Chikitsa and Udavartha Sakitsa. It can be done with medicines having Katu Rasa, Ushna Virya Sratho, Shodana Nature. Ayurveda management of dysmenorrhea includes Kashaya Kalpana like Gandharvahasthati Kashaya, Sapthasaram Kashaya, Kanasathawadi Kashaya. Chorna Kalpana like Hingu Vachati Chorna, Vaisvanara Chorna etc. Galika or Vati Kalpana like Dunvantharam Galika, Rajapravarthini Vati Kankayana Vati etc. Gritha Kalpana like Sapthasaram Gritha, Sukukumara Gritha, Varanati Gritha. Arista Kalpana like Abhayarishtam, Jirakad Hayarishtam, Ashokarishtam, Kumarayazavam, Dasamula Jiraka Arishtam etc. Hingu Traguna Tila 2 teaspoon at bedtime, 2 days before periods. Avagaham with Vatha Hara Pathra Ushna Jala. Vyarchana with Trivruth Layam, Hingu Traguna Tilam etc. In Vasti, Anavasana Vasthi with Pipalyati Tilam.
Kashya Vasti with Madhutalika Vasti also can be planned.
Another common cause of female infertility is endometriosis. In this condition, most women may not experience any symptoms. But some may experience pain, usually pelvic during or just before menstruation and lessens after menstruation, excessive bleeding and infertility. Ayurvedic considers it as an asaya apakarsaka gati, with involvement of all 3 doshas. Ayurveda line of treatment is based on the treatment line of Vaithiki Yonivyupat Chikitsa, Gulma Chikitsa, Vathanyalomana, and Raktha Prasadana Chikitsa. Here we are discussing on some of the common medications used in endometriosis. Kashaya Kalpana like Nirgundiadi Kashaya, Sukamaram Kashaya, Varanati Kashaya, Sapthasaram Kashaya etc. Gutika or Vati Kalpana like Gugulu Pankapala Chornam Galika, Kandraprabha Vati, Kanchanara Gugulu, Manasamithra Vedikam etc. Laya Kalpana like Sukamara Layam. Tila Kalpana like Hingu Traguna Tila, Pipalyati Anavasana Tila, Gurta Kalpana like Dadamadi Grita, Kalyanaka Grita, Ashoka Grita, Thrayanthiyadi Grita in bleeding phase etc. Can be used. Arishta or Asava Kalpana like Kumaryasavam, Chandanasavam, Nimbamrathasavam etc. Vyarchanam can be done with Kalyanaka Gulam, Aranda Tilam etc. Yoni Pichu with Dunvantharam Tila. Avagaha with Vathanya Pathra Ushna Jala. Dara with Danyamla Dara over painful areas are also found to be very effective. Even Lepa also found to be effective. PID is not known to many women because it is asymptomatic, but some may feel abdominal and lower abdominal pain, tenderness, high-grade fever, vaginal discharge with foul smelling and abnormal bleeding, painful copulation, painful micturition, nausea, and vomiting. PID symptoms may be worse at the end of a menstrual period and during the first several days following a period. Pelvic inflammatory disease can be considered as Pitta virity in Vathasthana. Treatments may include Tiktha Rasa Dravya intake. Sitha Virya, Stambana Dravya use, Madura Rasa Dravya etc. are to be used carefully. Kashaya Kalpana like Nayagradhati Kashaya Thikthakam Kashaya, Shanathamratham Kashaya, Amruthotharam Kashaya, Nirgundiadi Kashaya, Punarnavadi Kashaya etc. Vati Kalpana include Kandraprabha Vati, Vilvadi Galika. Arista or Asava Kalpana may be Imrutharishtam, Ashokarishtam, Lodrasavam, Saribadyasavam, Yushirasavam, Chandanasavam etc. Laya Kalpana Sathavaryahi Layam, Sukamara Layam. External treatments include Piku with Naupamara Tila. Avagaham with Naupamaradi Kashaya, Dasamulam Kashaya. Shalanam with Thrifala are also found to be effective. Uterine growths are tissue enlargements of the uterus. Among them, benign growths of uterus include uterine fibroids, adenomyosis, and uterine polyps. Uterine fibroids are benign growths of the smooth muscle inside the uterus. They are not cancerous, nor are they related to cancer. Fibroids are often described by their location in the uterus. Coming to symptoms of uterine fibroids. Most women with uterine fibroids have no symptoms. Heavy uterine bleeding, pelvic pressure, constipation and low back pain, infertility and pregnancy complications. When thinking the treatment of uterine fibroids are manifested in Apanasthana due to Pitta Kapha vritti. It is the Sitha, Manda and Guru Guna of Kapha that undergo aggravation here. So Ushnam, Vatha Anulomanam and Lakanam. Raktha Prasadanam, medicines are considered here. Kashaya Kalpana like Thanthyadi Kashaya, Nyagradati Kashaya, Varanati Kashaya. Chorna Kalpana like Pushyanuga Chorna, Gugulu Panchapala Chorna. Vati Kalpana like Chandraprabha Vati, Kanchanara Gugulu. Laya Kalpana like Kalyanaka Gula. Gritha Kalpana like Chiruvulwadi Grita, Varanati Grita Kalyanaka Grita etc. Piku with Dunvantharam Tela, Nalpamaradi Tela etc. When bleeding is predominant, Kasaya Tikta Rasam should be used. But these dravyas cause Vatavrti and increase in Raksa and Sita gunas. Here Madhura Rasam should be used to pacify Vata, and Satavari acts as a best uterine tonic in this condition as per Guruji Drive. L. Mahadevan Sir.
Adenomyosis is referred to as the uterine endometriosis, is a benign disease confined to the uterine muscle layer called myometrium. Endometrial cells from the lining of the endometrial cavity migrate from that lining, most commonly into the posterior side or back wall of the uterus. As these cells respond to monthly hormonal changes, blood can get trapped in the myometrium, producing a hard and enlarged uterus. Coming to symptoms, many patients with adenomyosis can be without symptoms, asymptomatic. Some may have dysmenorrhea or hypermenorrhea, heavy periods, prolonged bleeding cycles, large clots, cramps, abdominal bloating, back pain, painful intercourse, nausea, and vomiting. Pitta shamanam, rakta shamanam, Kaphahara chikitsa with Thikta Kashaya rasa medicines can be given.
Uterine polyps are benign polyps comprising endometrial, adenomyomatous, and placental polyps. An endometrial polyp or uterine polyp is a mass that arises due to hyperplasia of endometrium. Adenomyomatous polyps has smooth muscles as well as endometrial elements. Uterine polyps may be asymptomatic. However, some women may experience menorrhagia, metrorrhagia, postmenopausal bleeding, postcoital bleeding, etc. Placental polyps are formed from retained placental tissue. It may occur after an abortion or normal term delivery. Symptoms include secondary postpartum hemorrhage or intermittent vaginal bleeding. Coming to treatment of uterine polyp. Uterine polyps in general are considered as kapha vriti in Vata stanam. Vasti Gatha Gulma Chikitsa can be followed. In endometrial polyps, Kapha Shamana Chikitsa, Ushna, Annulomana are done. In cases having heavy bleeding, Rakta Sodanam and Rakta Prasadanam. Rasayana Dravya, that is given after Vyadi Shamanam, should also be anti-cancerous in nature. In case of adenomyomatous polyps, involvement of endometrial and the smooth muscle layer of the uterus. Here also Kapha Vatha Shamana Sikitsa should be done. Ayurveda medicines for uterine polyps. Kapha Shamana Chikitsa, Ushna, Annulomana is our line of treatment. Kashaya Kalpana like Varunadi Kashaya, Chithrika Grantyadi Kashaya, Gugulu Thikthaka Kashaya, Shadangam Kashaya etc. Gutika or Vati Kalpana like Chandraprabha Vati, Kanchanara Gugulu Shiva Galika. Rasa preparations like Kalyanaka Sharam, Rasa Sindoram etc. with honey. Gritha like Balathaka Gritha. Rakta Sodanam and Rakta Prasadanam can be done with Kashaya like Nyagradati Gana Kashaya, Aragwadati Kashaya. Chorna Kalpana like Pushyanuga Chorna. Rasa preparation like Loha Basma. Gritha Kalpana like Thikthaka Gritha, Datamati Gritha etc. Roga Apunarbhava can be done with Gugulu Thiktha Gritha, Pipali Rasayanam, Balataka Gritha etc. In placental polyps, the first phase should be to cleanse the uterus. Here Garbha Shodhanam followed by Kapha Shamanam should be done. Vyarkanam plays an important role. After considering the Agni Balam and Diha Balam of the patient, Vyarkanam should be prescribed with Sukumara Arandam etc. Based on the symptoms, Apravarthi or Athipravarthi treatment should be done as explained previously. By this dosha Shamanam will be established. Then Dhathu Pushti and Rasayana type of Sakitsa should be given. This prevents recurrence and regularizes menstrual cycle. Leya Kalpana like Sukumara Leya, Sabhagya Shanti, Kushmanda Leya, Shathavari Leya, etc. Gritha Kalpana like Maha Thikthaka Gritha, Sukumara Gritha, etc. can also be given. In this presentation, we tried to explain the Ayurveda perspective of female infertility and its management in a very concise way. We shall continue our discussions on each of these topics in detail. Our next topic can be male infertility and its Ayurveda management. Thank you. Dr. Jeevan signing off. Have a healthy life.